Did you know that up to 50% of nursing students who start a program either fail or drop out? No student begins a nursing program with the intent to fail. You don't have to either. Don't be a statistic. I want to warn you, there are 4 traits that the nursing literature has identified that are common with those students who are not successful in nursing education. Trait number 1, they are unable to function in a fast-paced clinical environment. What do these behaviors look like? Well, first of all, they are unmotivated as well as uninterested. They are also unable to think critically and lack the basic skills or comfortable with those basic skills they've been taught in the program. They also tend to fly under the radar and don't want to be noticed by the clinical instructor. That is a clinical red flag. Trait number 2, these students are at risk to jeopardize patient safety. How do they do this? Well, in many ways, they are unsafe. They may leave the bedside unattended or the bed in the high position or not use the transfer belt or transfer skills that they were taught in the nursing program. They also tend to be overconfident and thinking they got this, when in fact, they don't. Trait number 3, they are unprepared when they come into the clinical environment. These behaviors include being unprepared for the clinical experience or even being late. They also make excuses and don't take responsibility for their own learning. And finally, trait number 4, they have difficulty communicating with the educator, with their peers, and the staff nurses in the clinical setting. These behaviors include difficult communication skills, feeling awkward in how they communicate with the staff as well as with the patient. This also includes uncaring behaviors where they're not highly engaged in the clinical and patient care setting. Take a minute and reflect. Did you see yourself as a student in any of these behaviors? If so, don't hit the iceberg. Now is the time to reflect and do things differently. I also can help you. I've written a book, Think Like a Nurse, Practical Preparation for Professional Practice, that contains essential need-to-know content that can help you transfer learning from the classroom to the bedside, as well as helping you understand clinical reasoning so you can think more like a nurse. If you want to be successful, you don't want to miss my next video coming out shortly on the traits of highly successful nursing students. Check out the link on this YouTube video for more information. Or better yet, subscribe to this channel, Think Like a Nurse. It is my passion for you to be successful and not an unnecessary, tragic statistic.